Hello and welcome. Today, we're diving into a common yet often misunderstood condition, gastritis. We'll explore what it is, what causes it, and how it's managed, providing you with a comprehensive understanding of this digestive ailment. So, what exactly causes gastritis? The most frequent culprit is infection with Helicobacter pylori, or H. pylori, bacteria. This sneaky microbe burrows into the stomach lining. Other common causes include regular use of pain relievers like ibuprofen and naproxen, excessive alcohol consumption, and chronic stress. Less frequent causes can be autoimmune disorders, bile reflux, and certain infections. Let's look at the pathophysiology. Gastritis, at its core, is inflammation of the stomach lining. When harmful factors like H. pylori or NSAIDs disrupt the protective mucus layer, the stomach acid can irritate and damage the underlying tissue. This irritation triggers an inflammatory response, leading to redness, swelling, and even erosion of the stomach lining. Over time, chronic inflammation can lead to thinning of the stomach lining and potentially long-term complications. Gastritis is incredibly prevalent, affecting millions worldwide. The exact numbers are difficult to pinpoint because many people don't experience any symptoms and never seek medical attention. However, H. pylori infection, a major cause of gastritis, is estimated to affect a significant portion of the global population, with higher rates in developing countries. Lifestyle factors such as diet and alcohol consumption also influence the incidence of gastritis in different regions. What are the telltale signs of gastritis? Symptoms can vary widely. Some people experience no symptoms at all. When symptoms do appear, they often include gnawing or burning pain in the upper abdomen, nausea, vomiting, a feeling of fullness after eating only a small amount, and sometimes loss of appetite. In severe cases, gastritis can lead to bleeding, resulting in blood in the vomit or dark, tarry stools. Diagnosing gastritis usually involves a combination of strategies. Your doctor will likely start with a physical exam and a discussion of your medical history and symptoms. To confirm the diagnosis, tests may be performed. These include an endoscopy, where a thin, flexible tube with a camera is inserted into the stomach to visualize the lining and obtain biopsies. Tests for H. pylori, such as blood tests, stool tests, or a breath test, are also commonly performed. Gastritis can be categorized in a few ways. Acute gastritis comes on suddenly and usually resolves quickly. Chronic gastritis develops gradually and can persist for years. Additionally, gastritis can be classified based on its cause, such as H. pylori-associated gastritis, autoimmune gastritis, or reactive gastritis caused by chemical irritants. Managing gastritis aims to relieve symptoms and treat the underlying cause. If H. pylori is present, a course of antibiotics, typically combined with a proton pump inhibitor to reduce stomach acid, is prescribed. For gastritis caused by NSAIDs, discontinuing the medication is crucial. Other treatments may include antacids to neutralize stomach acid, proton pump inhibitors or H2 blockers to reduce acid production, and a bland diet to avoid further irritation. In severe cases, hospitalization and intravenous fluids may be necessary. Preventing gastritis involves minimizing risk factors. This includes practicing good hygiene to avoid H. pylori infection, limiting alcohol consumption, using pain relievers cautiously and with food, managing stress, and eating healthy diet rich in fruits, vegetables, and whole grains. Avoiding foods that trigger symptoms is also important. The prognosis for gastritis is generally good, especially when the underlying cause is identified and treated promptly. Most people experience symptom relief and healing of the stomach lining with appropriate management. However, untreated chronic gastritis can lead to complications such as peptic ulcers, stomach bleeding, and, in rare cases, an increased risk of stomach cancer. Recent research is focused on developing more effective treatments for H. pylori and exploring the role of the gut microbiome in gastritis development. Some studies are also investigating the potential of natural remedies, such as probiotics, in managing gastritis symptoms.